Good morning, or well, good afternoon to all of you. Thank you, Adiseo, for giving me this opportunity to talk to you and share my experience on mycotoxins, how they affect the animal's functioning, the reproductive, digestive, and the respiratory system, and what can be done about it. So we will first highlight a little bit the situation globally, then the mode of action of the different mycotoxins, and then what I am, a vet. I will highlight the veterinary aspects of mycotoxins in more species, but of course my expertise is poultry, so I have a small video to show you where you can find the lesions in poultry. Then diagnosis is very important and not easy for mycotoxins, and then what can you do about it. So if we look globally today, and Adiseo contributes to examine and take samples from different parts of the world to see what is the situation. What we see is that a lot of our animal feeds are contaminated with mycotoxins. There are aflatoxins, zearalenone, fumonisin, DON, ochratoxin, and very often they come together. If you find one mycotoxin, usually you have more of them. That is the rule when we look at those samples. And then what we also, or what is not always clear, is that what is the effect of the subclinical levels of mycotoxins. As we say, usually it is multi-contamination, different mycotoxins, all in different levels, and they also have a synergistic effect. So 1 + 1 is 3 in case of mycotoxins. Most of the samples that we find can even comply with the European regulations or recommendations on levels of mycotoxin, what is the maximum tolerable concentration in feeds. We have regulations on that. But we also know that even if they do not reach that level, there is still an impact on performance and health of the animals. So we are talking here of a not so easy to diagnose problem, and a problem that is mostly underestimated, because we measure mycotoxins very often, but we also have metabolites from the mycotoxins that also have an effect, or modified mycotoxins. And recently, research has also shown that there are many emerging mycotoxins where we still have to examine the effects, like the eniatins, bovericin. All these things are still to be examined. So here we have a few overviews or examples of samples that have been examined all over the world. We have some figures from cereals and corn in Poland, Spain, but also US, France, UK, Brazil, so Russia. So this is really a global concern. There's not one country that can say we do not have. Also in Belgium, on our wheat that we harvest here, we also sometimes have mycotoxins. And so, as we said, it is a global threat, and what we fear is that with changing climate conditions, this is not going to reduce, but it's probably going to enhance the occurrence of mycotoxins. So we will see that, and like we see with insects also, and intermediate hosts of some of our parasites, is that they are moving up with global warming. So mycotoxins today for our animals, production animals is mainly what we are talking about today, is definitely a major problem, but we not always see a real acute disease, like acute mortality, so the effect is more insidious. So we have clinical or we have clinical disease, but mostly we see subclinical disease. And that is why we need more performing diagnostics to be able to also detect this. So even if there is only low or moderate levels of toxins, they can still have an effect on metabolic, physiologic, immunologic functions of the animals, and so it will affect health and performance. The other thing to be aware of is that there is a risk of human contamination, depending on which products we are dealing with from the animals, but we know like aflatoxin can pass in the milk of the cows. We also know that there is proof of ochratoxin, aflatoxin in eggs, so it can also contaminate the people eating the eggs, and in meat, although that is more rare, but there is a possibility. So one of the concerns of mycotoxins is also human food safety. So that is why monitoring in feed and food is important, not only to determine can we use this raw material for the quality of the feed, but also food safety. And then the next step that we are coming to now slowly with biomarkers is how can we measure exposure in the animals? Because that is what we want to know. How much risk is my chicken or pig or cattle at by eating this kind of feed? So the different mycotoxins in this table, I wanted to highlight their mode of action and then also the main target organ. I know this is not a complete list, but when we talk aflatoxin, we know this has an effect on your DNA, RNA in the liver mainly. It also is carcinogenic, but the organ that we will, in the lesions of acute intoxication, the target organ is definitely for aflatoxin will be the liver. So for the trichotoxins, DON, T2 toxin, they have more an impact on protein synthesis, so they will inhibit this protein synthesis, which of course is happening in different parts of the body. But the main effects that we will see is intestinal mucosa. It is caustic for the intestinal mucosa, also for the skin. But as I said, I wanted just to highlight the main target organ to make it easier for in the field to what organs are we going to look at for the different mycotoxins. The zearalenone, we know that has a big effect on estrogen receptors. So of course, the reproductive organs here will be the target, main target organs, as well in the male as in the female. Then fumonisins they can inhibit the sphingolipid biosynthesis, which is very much implied in the nervous system. So that is why with these mycotoxins, we very often see the clinical lesions in the nervous system, although they also can affect intestinal tract. We know that, but as I said, focus on the main target organ in clinical symptoms. And then ochratoxin A disturbs the physiology in cellular physiology in many ways, but very often the first signs that we see are in the kidneys. So that is, we will see in the different species, ochratoxin, first clinical signs or lesions we will find in the kidneys. So let's come to what my talk is about. What, as a vet, or what are the health signs that we can see in mycotoxins in the different species, and then focus on poultry because that's my expertise. So if we look at the different mycotoxins, we can see that they do have an impact on general animal health. As we can see, the circulatory system, heart, lungs, respiratory can be affected. Also the brain, we see sometimes, like even with aflatoxin, we can see paralysis sometimes in poultry, for example, but we have other syndromes with the fumonisin in quail or horses, for example. Then the intestinal tract, and that of course is very important because everything you put in, the feed you put in that is contaminated with the mycotoxins, so the first target will be there in the stomach, and we will see how it affects really the basic functioning of that intestinal tract. And then the liver, of course, also together with the kidneys, a very important organ for detoxification. So if your mycotoxin is going to affect liver or kidney, it will have a general impact because your normal detoxification processes are, well, compromised. And then something else that I, in my personal experience, have come across a couple of times is that mycotoxins can have an effect on your reproduction, breeding. What we know, parent stock, so the mothers of the chickens the chicks we want to produce, if they are affected with mycotoxins, this can have an effect on their performance, but also on hatchability and on the growth, the quality of the day-old chicks, which is in poultry production, one of our main targets that we want to achieve. And then in general, it affects the immune system. That has been proven in many studies, but this is something that is sometimes, and we talk about subclinical levels, how are you going to prove that the reason why you have so many other diseases, in fact, is because you have mycotoxins that compromise your body defense mechanism. So, and in general, if we look at the effects that mycotoxins can have on animal health, it's always a mixture of all these three parts. You have the mycotoxin, so of course this is going to the dose that you have there, the type of mycotoxin, the time of exposure, which is also a very important factor when we talk about clinical, subclinical effects of mycotoxins. And is it one mycotoxin? But as we said, very often you have multiple mycotoxins. So that is one aspect that is going to have an effect on what it's going to do to your animal, but also the animal itself, of course, depending on the species. We know poultry, for example, they are maybe the less sensitive. So what happens sometimes is that feedstuffs that are not going to be used in cattle and pigs because they are more sensitive species, are going to go into poultry feed. And of course, maybe the level is not going to be high enough to get clinical symptoms, but it will still have an effect. So species, breed, different layer birds or meat production birds, but of course in pigs also you have the different categories, dairy cattle or meat cattle, age, gender can have an effect. If we talk about reproductive systems, which will, if your males are also affected, it will have a general impact on fertility. Health status of the birds, if they are already, well, in less good condition because of parasites, coccidiosis, I don't know what, it will also affect, and of course, functioning of the immune system. In every species, we have diseases or conditions that can affect your immune response. And then the third factor, also very important and cannot be neglected, is of course the environment where we keep our animals. So good management, biosecurity, hygiene, good conditions in general in the housing of our animals is important, and will determine, all these three factors together will determine what are you going to see in the field. So this is a slide that I borrowed from Günther Antonissen, professor at the University of Ghent, and he's done a lot of work on mycotoxins. And I think this is very important for all the rest that we are going to develop, because this slide talks about what are mycotoxins doing in the intestinal tract. First of all, what we see is that it's going to affect intestinal permeability. And we see here the different mycotoxins. All of them have an effect on the permeability, which means that once you have mycotoxins in clinical or subclinical levels in your intestinal lumen, it's going to affect those tight junctions between the intestinal epithelium. It's going to make that you get a leaky gut. Not only the mycotoxins, but all other substances that are supposed to stay outside of the bird's circulatory system are going to be able to enter the circulation. So we have an effect on inflammation. They induce oxidative stress, which of course is something that is not compromising the normal functioning of your gut. And very important, there will be a shift in intestinal microbiota. Most mycotoxins will have an effect on that and will make, for example, that the commensal community of bacteria will be compromised and that pathogens or pathobionts that are there take the opportunity to do harm in the intestinal tract. So also an effect on local immunity, IgA production, and recovery of your cells. So cell proliferation is something that is needed to, if you have an injury, to recover, and this is compromised in with many of the mycotoxins. So how would this modulation of the intestinal function happen? Even at subclinical levels, you will, looking at what happens in the former slide, you will see that there is an effect on the physiology, immunology, and the metabolic actions happening in the intestinal tract. And the consequences are that it will affect your performance because there is no normal digestion and absorption of nutrients because of the damage done by the mycotoxins. This increased permeability will also compromise the normal mucosal barrier function to keep out the bad things and to absorb the good things. And we will have, in general, more susceptibility for any infectious disease. So that's why the effect of mycotoxins in the gut is so important. So let's have a look at the different species, what you will see in clinical manifestations of mycotoxins. So that means that you already have a high level, but you will have in swine, but in all species, reduced performance. Reduced performance also because the feed utilization and efficiency of digestion is compromised. We get impaired fertility, and you can sometimes see tail necrosis, ear necrosis in swine, skin lesions. Same in poultry, reduced performance. One of the things we often see is the fatty liver. An effect on egg production, also on the quality of the eggs. We see sometimes meat spots, blood spots due to mycotoxins. And in the end, because of a general effect on performance, you will get poor carcass quality. And then in horses, for example, we have this syndrome where you see neurotoxic lesions. And even in fish, because don't forget, this is also important for fish, we will see that they have abnormal body conformation and also lesions that resemble a little bit what we see, for example, with Ziralaneone in swine, that you see protrusion of the anus, for example, something that we can see in fish. So aflatoxins, main target organ, the liver, you can see here we have a normal colored liver, and all these are different levels of aflatoxin that cause fatty generation. You also get liver affection in the pigs, for example. Ochratoxin A, typical target the kidney. You can see pig nephropathy, so necrosis and lesions in the kidneys as well in pigs as in broilers, where you can see swollen kidneys. And then the effect on the reproductive tract of Sierra Leone. Here is what you see in young female pigs, and also abortion, also an effect on the reproduction. Here what we see, this is in chickens, where you see cystic oviducts. This is a sign of Sierra Leone, and very important, this is a normal testicle of a male chicken, and here we see with mycotoxins atrophy. Of course, this is not going to give you a lot of chicks. And then nervous signs in, you see this poor horse suffering from equine leukoencephalomalacia, but also in quails we have a nervous system with nervous disorders with this mycotoxin. Then if we look at DON and T2, as I said, the intestinal tract is very much affected by the caustic effect, but also the lesions that you see on the little piglet and the tail necrosis in this sow. No, it's not a sow, it's a boar, sorry. I'm not a pig specialist, but I should be able to see this. Then ergotamins, one of the mycotoxins that we know for many years. It's even in some paintings of our famous Peter Bruegel, where you see in humans skin necrosis, but we also see that in these are calves with skin necrosis. Here you see it in a chicken, and here the ear necrosis in pigs. And here are the fish effects that they saw in rainbow trouts with DON, where you see that the body of this fish is not completely normal, a big belly, and then the protrusion of these this anus, in fact, and you also see kidney and liver lesions. So this has all been described in literature. And then I would like to come back to what I know best, is poultry pathology. And here we see, and I have a small movie on that, gastrointestinal lesions, feathering, the liver affected, sometimes subcapsular hematomas. Egg quality, what you see here is damage done by ochratoxin, also kidney problem, bruisings, the blood clotting can be affected by mycotoxins, and even lameness sometimes. So let's watch together the video that we prepared for you on necropsy. Sorry. So what I want to show you is how we can do necropsy on this layer. And we will focus on where you are looking for lesions caused by mycotoxins. So these are normal feathers. You will see with some mycotoxins like trichotoxins, DON, you can have lesions of abnormal formed feathers. So this is where you could see abnormalities when the feathers are not normally developed. So this is how normal feet and toes look like. In some conditions caused by mycotoxins, specifically ergotamines, you can see necrosis of the toes. So then we'll inspect the head and the mouth cavity, where you can see here the choana that are clear. It's the top part of the mouth, in fact, connected with the nose also, and also the tongue. This is a normal tongue. If you have mycotoxin intoxication in acute cases, you can see lesions on the mucosa of the mouth, here on the choana. Also, the tip of the tongue can be necrotic, turns out black, and you see kind of ulcers also on the side of where the beak ends. So we open up the abdominal cavity. So this is a young layer. And here you see the organs in situ. Immediately you can see the liver. This is reddish, brownish. That is a normal liver. In cases of intoxication with aflatoxin, for example, you get fat deposit, fatty degeneration of the liver. So you will have more orange, even yellowish liver color. So we remove the intestinal package. And what we can see here is a normal aspect of the intestines. You don't see any hemorrhages. This can be the case in some intoxication with mycotoxins. You can see hemorrhages on the intestine, big spots of hemorrhage. So then we will open up the stomachs and the proventriculus, because there also sometimes you can see lesions. So this is the proventriculus that we open up, and in some cases also because of mycotoxins you can see hemorrhages here in the proventriculus. Then we open up the gizzard, because this is also where we will look for lesions. We remove the contents, and then we look for ulcers. So this is normal aspect of the gizzard inside. So in case of mycotoxins, you can find lesions, ulcers here, but mostly also on this side. Sometimes you can only see it when you remove the kaolin layer, so underneath, but in fact all these ulcers are due to caustic effect of the mycotoxins. So this is the inside of the gizzard, the mucosa without the kaolin layer, and in case of intoxication with mycotoxins you can see ulcers when you remove the kaolin layer, also sometimes even with the kaolin layer on top of it. You can even find that in very small chicks, maybe due to breeder intoxication. So then we have a look. This is a layer where you can see the immature ovaria. It's a young layer. And underneath you see the kidneys, and this is the normal aspect of kidneys. They are reddish, brownish color, and you don't see any in case of mycotoxin intoxication, for example with ochratoxin, you can sometimes find or very swollen kidneys or signs of urates inside the kidneys. So this is a young layer. What we see here is an ovarium that is not yet developed, but we know that some mycotoxins also affect the reproductive tract as well in the female as in the male, where you can get regression of your ovaria, and you can also get testicles that are undersized, so atrophy of the testicles, and of course this will have an effect on your fertility rate and hatchability. So I hope you learned something from the necropsy session, and so what I want to highlight, because in poultry production this is of course very important, is the performance of the breeders, and they can be affected by mycotoxins. What we will see is that in bad cases even your feed intake will be lower, and of course your feed conversion will go up. Your efficiency of transforming feed into meat or eggs is lower. So an effect on your production, less eggs, and even the ones that are produced can have reduced hatchability. The end product of breeder production is quality chicks. So mycotoxin can have an effect on your shell quality, also on the hatching process, because if your shell quality is not good, during incubation, you will have altered moisture loss, and also the exchange of gases in bad quality shells is less good, so it will have an effect on chick quality and more embryonic mortality. And also sometimes we saw some of the mycotoxins affect really DNA, so you can really have deformations. Egg weight can be lower, fertility goes down, more mortality as well in the breeders as in their progeny, and the chick quality goes down. So if you look at egg production and embryonic mortality, there is a connection in the sense that these studies are with effects of aflatoxin and ochratoxin, but also the other mycotoxins can have an effect on egg quality and embryonic mortality, because as we said at the start, there is the effect of your mycotoxin in the intestinal tract, which will compromise nutrient absorption, but also calcium and vitamin D3 absorption, which you need for the production of a good quality shell. Then in the liver, you will have the protein synthesis that is compromised, so that will also affect the transport of calcium in your circulation, also other pigments like vitamin A that can also be affected by the mycotoxins. And then in the kidney, you have more excretion of calcium, which means that there is less available for good shell production. The plasma concentration of calcium and phosphorus is going down, more calcium is going to be mobilized from the bones, and this will result in thinner eggshells. During incubation, this has an effect on exchange of moisture and gases, which will affect the condition of the embryo, and you will get more embryonic mortality. So here in these graphs, you can see, and the important is to note what I put there in green is that the concentrations were within the EFSA regulation range, but still you can see with different mycotoxin, ochratoxin, aflatoxin, and it also states when or the exposure of days. Also with DON, you have an effect on egg production and consequently also on embryo mortality. So these are the effects that you can see with exposure, and as I say, important to note is that it's not even in concentrations that are higher than what is determined in the regulation. So what you saw in the graphs is a synergistic effect, what we usually see with mycotoxin of ochratoxin and aflatoxin. And important to remember is that these mycotoxins can also be transferred to the egg, so they have an effect on the chick, of the embryo. So the chick, there can be embryo mortality, or a chick that is born but with a compromised immune system, with lower transfer of antibodies through the yolk, with lower weights of the immune organs, the bursa fabrici and the thymus, and so that makes that your chicks will be more susceptible to infections and you will have early mortality. So then diagnosis, as I said, not always easy if you have subclinical infections with or contamination with mycotoxins, and then you, as I said, you see other diseases, you see other problems, and to relate that to mycotoxin can be a challenge. For example, reduced hatchability before you come to the feed of the breeders and find mycotoxins there, sometimes that's a long way to go. Because, and also in this case, for example, what we saw were ulcers in the gizzards of day-old chicks, and in the end we could prove that there was a problem with the feed of the breeders. But of course, there are other reasons why you can find ulcers in the stomach. Can be high temperature in incubation, or adenovirus, for example. So it's important to monitor in the feed or the food for humans, for the quality of the feed and food safety for people, but also for our animals. So already it starts, for the monitoring, it starts with the problem of the sampling, because mycotoxin contamination is not uniform in a batch. Say you have a boat that arrives with corn from I don't know where, and you want to check for mycotoxins. The way you sample is very important, because you can have hotspots with contaminations, and if you don't do a good sampling, then you will have a problem. So that is one aspect, and the other one is that if we want to see, or are mycotoxins implied in problems that I see in the animals, then what we want to get in the picture is the exposure to mycotoxin in the animals, and therefore, or humans, and therefore we make use of biomarkers. So we will look at bodily fluids, blood, urine, feces, sometimes meat, milk or eggs, and then we will see, we will try to find the mycotoxins, and also we can look at biomarkers of effect, biomarkers that indicate inflammation, biomarkers that indicate lower immune response, for example. Important, I'm not a specialist in that, but you have different analytical methods depending on what you want to prove or what you want to find. You have very specific qualitative and quantitative analysis, where, for example, for legal regulations, and some of them will, like the high-performance liquid chromatography, you can identify single mycotoxins. You also have tests, the liquid chromatography, mass spectrometry, where you can have a different or multiple analysis of different mycotoxins. And then we have cheaper rapid screening tests in ELISA, so they can give you a good idea, but of course this is not very, they are less sensitive, so usually you will do a screening and then afterwards a more performing test. So depending what you are looking for, what type of matrix you are examining, you will have a different test. And then a brief word on the biomarkers, because they are very useful, because they will show you really in the animal what is happening there, or what are the levels of mycotoxins. So there is a lot of work going on in that area. Some of it is done at the University of Ghent, where, for example, they looked at to see if some mycotoxin binders or detoxifiers, what is the effect in the broiler or in the pig, and therefore they saw that for pigs there is a good correlation between the concentration of mycotoxin in the feed and in the animal, in the pig. For broilers, we are still on the way. I'm sure we will soon find better biomarkers, but so it's important when you work with these biomarkers or look at results that you take into account, is this the best marker in this, for this mycotoxin, for this animal? Because you can look for the mycotoxin, maybe for metabolites of mycotoxins. What is the best matrix? Is it blood, plasma? Is it urine? Is it feces? Depends on the species, on the mycotoxin. Also, the timing is important. So when are you taking this sample? When do you expect the exposure has taken place? Because that, of course, will influence the content, the concentration of mycotoxin or maybe metabolites. And then the toxicokinetics for each mycotoxin is different. So that is also something to take into account when you choose biomarkers. So we have good proof. We have some trials done in broilers for aflatoxin DON OTA, and for pigs with DON and zearalenone, that gave us some good results. So here in this study from Tommy van Limbergen, he saw a good correlation between the feed and the plasma of DON. Higher level of DON in the feed, higher level of in the plasma, and that was correlated to a tail necrosis in the piglets afterwards. In the broilers, the test that, the trials that, this is from a trial that is well, not yet published, but in any case, they didn't see a very good relation. So where the search for biomarkers in broiler is ongoing. Sorry. So biomarkers, I would say in broilers, the golden standard remains feed analysis. And then control and prevention, we also have to, as we saw what mycotoxins can do, we can do some symptomatic treatment, try to support recovery. Intestinal health is very important there, anti-inflammatory, antioxidant, support liver and kidney function, and help detoxification, yes, because that is what the mycotoxins are doing damage. And then important in your mycotoxin control is to have an integrated approach. It starts at the harvesting in the field already when the plants grow, and you have to go on with your surveillance until it reaches the animal. So good agricultural practice and good manufacturing practice are necessary for that, the right processing techniques, and then make sure there are good feed additives that can bind mycotoxins or can modify mycotoxins, but you always have to be aware about efficacy and safety, because if you overdose, you might have a problem. It can also, for example, capture vitamins and other needed substances. And no, there is no mycotoxin detoxifier that is universal for all mycotoxins. So the substances that we use, they will suppress or reduce absorption of the mycotoxin. They will also help excretion, so that the exposure time is reduced, and they can also have an effect on the mode of action of the mycotoxin. So make sure that you be aware that if you use too much or the wrong binders, that you can have a problem with minerals and nutrients that are absorbed. So that's the end of my presentation. My take-home message for you is that you must be aware of mycotoxins. It's a global concern, and it's from many evidence sampling, we know that there are a lot of mycotoxins there, and that sometimes they are subclinical, but they do have an effect. Clinical symptoms are maybe rare, but if you have them, then you really have the tip of the iceberg. But most commonly we see subclinical effects, so it affects intestinal integrity, immune response, so more other diseases. So important to do a good monitoring on the feed and the food to assure quality of the feed you give to the animals and to assure food safety for the human consumer. And in the future, I think we will find better methods to find or give evidence of the mycotoxins in the animals with biomarkers. So for the control, we have to rely on an integrated approach from the field to our table, and we have to avoid, of course, contamination before the feeds are ingested by our animals. And if we have problems, we need to focus on the target organs to make sure that we protect them so that our animals can be healthy and performing well. Sorry. So with that, I want to thank you for your attention, and I'm ready to answer any questions if you want.
Thank you very, very much, Hilde. was a very interesting presentation, and I especially enjoy the movie. However, I have to say that participants couldn't see the movie because of internet connection, and I hope that we can follow up this issue and send a separate link to them. And all participants who could not enjoy the video of Hilda presentation on organs, you please contact us, and we will make sure that you will get a link. We have several questions, Hilda. However, we have only 10 minutes left for the question session. And the first question is about the climate change. And the question is that climate change will impact the mycotoxin prevalence, as you said. But what about the impact of regulation like EFSA on fungicides and pesticides? Because EFSA would like to reduce them.
I'm not sure I understand the question. The fungicide is in the fields, you mean?
Yes, I know a little bit this topic, and EFSA is trying to reduce the use of pesticides and fungicides. That means that the issue of mycotoxins will be higher.
Will be even
But
more, yeah.
yes, and at the same time, EFSA or other governments in other countries, they try also to reduce acceptable levels in feed. It doesn't, how it could be possible to make it?
Well, I think, yeah, there is a conflict there. Definitely, I think with climate change, we will probably have, well, a shift of where we have more mycotoxins. And we also see that climate conditions are more extreme, which is not going to help for our mycotoxins. And we will have heavy rains where humidity is high, maybe higher temperature. Well, maybe some places it will also get colder, so they will have less mycotoxins. But anyway, I think in general, we can expect more mycotoxin contamination. If then on the other side, they are going to limit the use of fungicides, it goes together probably with, like, we want to reduce antibiotics for bacteria. So then we'll have to look for alternatives. And well, as I said, integrated approach. So you will need to take measures in the field and to make sure that your crop is protected, if you can, from the fungus. But then even more, we will have to focus on making sure that the feed that we make, the products that we use, are mycotoxin free, or at least protected for mycotoxins. So yes, this is definitely an issue. Okay, I'm not European regulator, but I would, the same with antibiotics. I think we can look for alternatives, and innovation is going to help us. But the problem will be there, so it will need to be solved.
So, and do you think that one of the most promising solution will be use of products, mycotoxin
Well, I do
deactivators, right?
think, and well, as far as I know from the poultry industry, there is more use of mycotoxin binders and detoxifiers than we sometimes think, because they know that, and raw materials, like Belgium is a small country, if one feed mill has to protect, all of them have to protect, because they are mostly using same raw materials. So I do think there will be an increase, and also research is going on. First of all, monitoring should be more tight, I think, and then the use of these toxin binders or detoxifiers, and also, on the other hand, things to enhance or prevent the damage done by mycotoxins in the gut will take, will increase the use, I think.
Thank you.
Good. We probably have the last questions. Yeah, and the question is the diagnosis of mycotoxicosis easy in field condition, or the typical organ damage can be caused also by other factors like other than mycotoxins? For example, fatty liver, is it 100% sure aflatoxicosis, or?
No.
No.
That makes our job as a vet nice and interesting. There are many reasons why. That's what I was saying. Mycotoxins, before you get to the real diagnosis, sometimes it takes a lot of time. But you should never eliminate it from your differential diagnosis. And I think it's very present. But of course, liver damage can be done by viruses, adenovirus, big liver, big spleen. There are many other, feed is one of the, in layers. Your feed management is also going to have a big impact on the occurrence of fatty liver. But never forget that fatty liver can always be, and definitely if you also have problems with blood clotting, a lot of hemorrhages, then you should think in the direction of mycotoxins. But until now, since we don't have the perfect biomarkers yet, sometimes it's very difficult to prove. And then, the best proof sometimes is to put your product to avoid the mycotoxin, and then you can see an improvement. That is something, for example, that we saw in breeder farms, where you see, okay, once we start putting the product, the exposure is done. 3 weeks later, we see hatchability going up. Because that is when you will see the results of what you put in the feed in your breeders, once the first chicks start hatching.
Yeah, it's like diagnosis. Like diagnosis on
But
therapeutic effect.
as we said, mycotoxins are very prevalent, so don't exclude it from your differential diagnosis.
So, but there is no any ways to go to farm and say that we have mycotoxins looking at the animals.
Well, if you have clinical signs, yes. If you see those black tongues, if you see sometimes, the lesions in the intestines can be quite typical for all that combined can give you. And then if the proof in chickens will be, okay, we examine the feed and then maybe we find it.
Feed is number one. Yes,
the clinical signs of some of these are quite typical. I think we showed a few that were quite typical, but in the field, very often the lesions are not so heavy.
And levels are low, so we don't have.
But even low levels, but multi-mycotoxin infections, synergies between them, makes that the impact of your mycotoxin can be very important.
Okay, thank you, Hilda.
We have quite a number of questions, but not much time to answer. Only one, maybe. This is one about zearalenone. They say that zearalenone is less toxic to poultry, but what kind of levels or how high should be levels of concern for poultry breeders? Do you have any recommendation?
Well, I think we always look at the European regulations, and I don't have it in my head what exactly is for zearalenone. But even as I showed in my presentation, when levels, it was not zearalenone, it was ochratoxin or aflatoxin, but it's the same. The levels that you find, even if they are below EFSA regulation, you can never be sure, because you also don't know which other mycotoxin is involved. And as I also mentioned, the risk of finding contaminated raw materials in poultry is maybe a bit higher, because they are considered less sensitive than cattle and pigs. And so sometimes these raw materials will end up in poultry feed contaminated. So you always have to be aware. But I can come back to you with the levels, but I don't have that in my small brain. Yeah.
Thank you.
One quick question. Where can I test the biomarkers?
There are a couple of tests available, also from competitors. I know at the University of Ghent, they've developed, that group has developed their tests. But as I said, I think we still, and it is not going to be so easy to say, okay, we will just test the urine of the pig and we will find all the, no, I don't think it's that easy. First of all, matrix is important, kind of mycotoxin, timing of exposure, when are you to test, maybe you don't find anything with your biomarker, but the exposure was, well, too long before, it's already excreted, or, and that is different. That is, I think Olga can tell us more about the toxicokinetics of the different mycotoxins. That is something to take into account. So there's no universal, not yet. But I think,
you're right.
It will come. It will come. Somebody there, yeah.
Yeah, indeed, the toxicokinetics is very different for each mycotoxin, but also in each species, and it's quite important to be correct in the time of blood sampling, for instance, or urine sampling, because it can depend. And regarding the laboratories, I think this is the biggest concern, because I think only a couple of laboratories in Europe can test it. I know University of Ghent, for instance, and INRA in Toulouse, and frankly saying, no other laboratories coming to my mind. Maybe ISPA in Bari in Italy, but it's not very available, and it's a university laboratory, and it's not just that you go to any and say, I want to test biomarkers.
So it's not that easy.
No, it requires, of course, validation of specific methods, but also use of standards which are hardly available.
But work in progress, I would say. So I'm confident that in a couple of years, maybe, we will have better ways to, and that's important, because I'm also very convinced that the problems with mycotoxins are underdiagnosed. There's more problems around than we know.
Thank you very much, Hilda, for your session, for answers. It was very interesting. We have more questions, but we follow up those questions unanswered during our talk. Later on, after the presentation, we contact participants directly with the answers.
Thank you very much all for listening.
It was a very nice session, a really good one, and I am looking forward to have the next one. And please don't forget to register for episode 4. And I would like to say that those who had some issues with the listening or following presentation, we will have a replay next Tuesday, 13 April at 4 o'clock p.m. This will be normally scheduled for Americas, but those who would like to see or hear it once again, please register for that one as well. I wish you a good day, good evening, and hopefully to see you soon. All the best to you.
Thanks a lot.
Bye-bye.
Thank you very much.
Bye-bye.